Good morning, dear Chairman, dear colleagues. So my topic today is the influence of venous tumor thrombus on the prognosis of pelvic osteosarcoma. The original work was done by Dr. Liang, who is not able to come today. The venous tumor thrombus is known to be seen in some retroperitoneal malignancies, including renal cell carcinoma, Wilms disease, and adrenal neoplasms. VTT is not rare in sarcomas. It occurs approximately 15% in pelvic osteosarcoma patients at our center. Radiographic features, including following presentations on CT scan, MRI, and PET-CT scan, are useful for the diagnosis of VTT prior to the surgery. Since there were only sporadic case reports in literatures regarding VTT and sarcomas, we performed a retrospective case cohort study aiming at answering the following question. What is the influence of VTT on the prognosis of patients with pelvic osteosarcoma? We included all the patients with primary pelvic osteosarcoma who were initially surgically treated at our center between 2007 and 2016, and excluded all the patients who were with secondary osteosarcoma or did not receive surgery. Results. The two groups of patients who were with or without VTT were largely comparable. Interestingly, we found that the patients in the VTT group were about 10 years younger than that in the non-VTT group, and they were with high proportion of chondroblastic subtype, lung metastasis, and invasion to greater sciatic foramen, sacral foramen, and L5S1 intervertebral foramen. We also found that the VTT group had more intraoperative bleeding, postoperative drainage, and worse surgical outcome. By comparing the operative and oncologic outcomes, we found that the VTT group had higher rates of death, recurrence, new distant metastasis, and new lung metastasis. Moreover, we found that the VTT group had shorter period of overall survival, progression-free survival, recurrence-free survival, and metastasis-free survival. On the other hand, we analyzed the oncologic outcomes in the whole cohort of patients. Candidate factors that potentially influence the survival of patients were sequentially subjected to univariate and multivariate analysis. So these are the results. We found that the pulmonary metastasis at presentation were a hazardous factor for all the endpoints, and lymph node metastasis at presentation were a hazardous factor for overall survival and recurrence-free survival. And longitudinal margin was the hazardous factor for recurrence-free survival. And postoperative local occurrence and new metastasis, pulmonary metastasis, were hazardous factor for overall survival. So in the present study, we demonstrated that the VTT group had higher proportion of lung metastasis at presentation and higher volume of intraoperative bleeding and worse surgical margin. Most importantly, we found that the VTT group had higher rates of death, recurrence, and new distance metastasis. We also found the VTT group had shorter period of survivals. Here we hypothesize the mechanism of VTT through which exerts its effect on pelvic osteosarcoma. The tumor cells in the patients bearing VTT are predisposed to distant migration and lung metastasis at presentation, which could increase the risk of postoperative systemic metastasis. Meanwhile, VTT lead to intralesional margin, which could increase the risk of local recurrence after the surgery. This factor altogether deteriorate the overall survival of the patient. We also proposed a surgical classification of VTT for pelvic osteosarcoma. Type 1 refers to VTT localized to internal or external iliac vein. Type 2 refers to VTT invading the common iliac vein. Type 3 refers to tumors invading the inferior vena cava, below the renal vein level. Type 4 refers to VTT invading bilateral iliac vein or vena cava above the renal vein level. Surgical intervention are recommended for both type 1 and type 2 VTTs, while Surgical intervention is only recommended in selected patients whose tumor was sensitive to neoadjuvant chemotherapy. Well, however, surgery is not recommended for type 4 VTT. So in conclusion, VTT is an active prognostic factor for pelvic osteosarcoma, and it warrants further clinical and basic science research. Thank you very much.